Well, months after the death of football legend Frank Gifford, his family revealing that the Hall of Famer suffered from a type of brain disease that's often linked to concussions. The Giffords said in a statement, quote, "We as a family made the difficult decision to have Gifford's brain studied in hopes of contributing to the advancement of medical research concerning the link between football and traumatic brain injury. Our suspicions that he was suffering from the debilitating effects of head trauma were confirmed when a team of pathologists recently diagnosed his as that of CTE, a progressive degenerative brain disease." Well, joining me now is Dr. Kevin Campbell. He is a practicing cardiologist and an assistant professor of medicine at the University of North Carolina. It's nice to see you today.
Nice to see you. Happy Thanksgiving.
And happy Thanksgiving to you. So, Dr. Campbell, can you just first off break down this disease for us?
So CTE stands for chronic traumatic encephalopathy, and what that is when you get repeated blows to the head, such as boxers and football players, it changes the structure of the brain, and this can cause symptoms such as aggression, personality changes, dementia, Parkinson's type symptoms, and can be separated by years from when you were a football player or a boxer.
Now, this is obviously a difficult decision by a family to have to decide whether or not to allow their loved one's brain to be, examined after their death. But there's a lot that can be learned, from what I understand, in being able to do that. Can you talk about that and where this medical research is going?
Well, we already know so much more than we used to. This was first reported in the 1920s in boxers. And now, as we have generous families that do donate their brains to science so that we can study them, we have determined that a particular protein called tau is abnormally deposited in the brain. And this could really help us, advance ways that we can treat this disease, identify it early. But I think most of this is going to be prevention of repeated concussions.
You talk about prevention, and of course, I'm sure a lot of people at home have children that play sports, football, even soccer, and this is a disease that's been linked to the deaths of several former football players. Junior Seau, who actually took his own life when he was only 43. So what do people need to know about prevention of this disease, and can this be prevented? And what about people who are playing in sports when they're at a pretty young age?
I think a couple of things. First of all, we have to change the culture. I think that kids need to be encouraged to come forward and tell the coach, hey, I'm a little fuzzy-headed, I got hit in the head, so that they identify that particular student as at risk. I think we also have to do a better job of identifying folks who do have concussions. Concussions don't always have loss of consciousness. If you get blurry or a little scrambled after taking a hit to the head, you may have a concussion and you need to seek medical care. We need to start early with the high school athletes.
Now, is this being looked at in military service members as well? A lot of military members have come back from fighting in the war with head injuries.
Exactly. We see so many of our veterans reporting to, the VA hospitals with behavioral changes or suicidal ideations or, depression and anxiety. And a lot of this may be from closed head injuries related to a traumatic brain injury. And I think that, we need to do a much better job in the VA system of assisting these patients very quickly, because this is becoming more and more common. And thankfully, the generosity of the Giffords and other patients like them to help us better understand and treat this disease.
All right, an important topic to be talking about, because this affects a lot of people, from military to people who are just playing sports. Dr. Kevin Campbell, thank you so much for joining us. Leland?